CLL is characterized by severe immune dysfunction, and that can lead to immune-related complications such as infections, second cancers, and then on the flip side, it can also cause autoimmune cytopenia. So supportive therapies really aim to mitigate some of these complications, and most of what we can do really is to compensate for the immunodeficient aspects of the immunodysfunction in CLL. So in terms of reducing infections, one can consider immunoglobulin replacement. That's actually, a very old type of immune boosting strategy that's still being used today. And patients who are experiencing recurrent bacterial infections and those with hypogammaglobulinemia can benefit from immunoglobulin replacement, whether that be intravenously or subcutaneously. In addition to IG replacement, patients might also, in the treatment setting, be candidates for antimicrobial prophylaxis. So that's really meant to reduce specific infections during treatment when the risk is highest. So they can receive antiviral prophylaxis, for example, to reduce shingles reactivation or HSV. And then certain treatments can also increase the risk of opportunistic infections like PJP pneumonia and CMV related disease. So there are agents that one can consider for high-risk individuals to try to minimize the risk of infection in that setting. And then during treatment as well, there are certain treatments, particularly Venetoclax-based treatment, that can cause severe neutropenia. So growth factor support can be used as secondary prophylaxis or to prevent severe neutropenia, and most importantly, febrile neutropenia, which is when a patient develops an infection in the setting of a low white blood cell count. They can then receive this growth factor support, hopefully that will restore their neutrophil count and allow them to continue therapy without dose adjustment or dose interruptions. So those are the main things. And of course, for all patients, they should be getting vaccinations. That's a very important supportive care that we can provide to all patients with CLL. And I typically follow the CDC guidelines for immunocompromised individuals. So they should be up to date with their pneumococcal and their shingles vaccines. And then of course the COVID-19 vaccines. There's a different schedule for immunocompromised people that's recommended by the CDC, so I tend to follow that as well. And annual influenza vaccination. So I think those are the broad strokes in terms of supportive care. And then with autoimmune cytopenia, I generally don't consider that supportive care because it is a more significant complication that requires treatment with immunosuppression usually, but that's something that affects CLL patients, especially those with advanced disease.